Welcome, and today we are gonna deal about chest injuries, which sometimes are less noticed, and also they are among the most painful and traumatic conditions on the chest. Chest injuries, they come in different forms, and sometimes they can involve multiple organ systems around the chest. And by this, we need to acknowledge that on the chest area, on the thoracic area, we have the respiratory system, but also we have the cardiovascular system, that is the heart and the major blood vessels around it. And in this case, traumatic chest injuries can include rib fracture, hemothorax, frail chest, and also pulmonary contusions. So we will look at these chest injuries one by one. So first, let's start with the rib fractures. So under the rib fractures, it's among the most commonest chest injury, and it can happen due to trauma, accidents, penetrating injuries, blunt object injuries, but all this they lead to breaking of bones or dislocation of the bones into various parts. And the rib fractures, they can interfere with our ventilations and they can lead to lacerations of underlying tissue injuries, tissue areas of the lungs. So how will the rib fractures present? Mostly in the rib fractures, you'll be pain at the fracture site. There'll be also shallow respirations for our patient when they are breathing, localized tenderness, but also crepitus or crackling sound when you're scaltating the lungs. And here is an example of our ribs look like if they're broken. So our patient here has a rib fracture of around 5 ribs, and this you can easily visualize using x-rays or other imaging methods that can help you check on the ribs. So how do you manage rib fractures? The rib fracture management mostly adopts the general management of fractures, but the main focus or priority management for a rib fracture is pain management. And in this case, we have administration of analgesics. This is to manage the pain and reduce it within a threshold that is manageable. But again, as you are also doing the analgesics, you need to check on coughing and deep breathing so that you can also be sure as the pain is getting relieved, you don't end up with retained secretions into our pleural space. So you want to cough it out and help in secretions. Then encourage these deep breathings with strong inspirations, while at the same time, the ribs, remember, they are separated from one another because of the fracture. And so, because of that, you want to also give local support, like get splinters or do splinting as a way of immobilizing these ribs and keeping them into stable positions to avoid further damage or further dislocation around the rib areas. So our next type of injury is hemothorax, and hemothorax simply means blood accumulating into our pleural space, and this blood can accumulate in that space due to different things, but here our main focus is the cause by injuries. So in the presence of a chest injury, either could be penetrating or blunt chest injury, it can lead to hemorrhage or it can lead to bleeding. And this bleeding or this blood that is being generated because of the trauma can result into accumulation in this pleural space. And while the blood is accumulating in the pleural space, it leads into a disease or a condition we call hemothorax. Unfortunately, most of the time when the hemothorax state is happening, the blood ends up hidden, and so we end up with hidden blood loss, meaning we cannot see this blood. So mostly our patients come with the signs and symptoms which are inclusive of asymptomatic. Asymptomatic means it's not very easy to tell the symptoms, or they do not show any sign to show that they are bleeding because it's an internal bleeding. The patient also will look dyspneic or presenting with signs of difficulty in breathing. They also look apprehensive, but others can start presenting with signs and symptoms of shock and in this case talk about hemorrhagic shock or also hypovolemic shock because of the loss of blood. So how are hemothorax managed? Mostly here you want to remove the blood accumulation, so patient can be encouraged to go for thoracentesis, which is simply aspiration of blood from the pleural space, or accumulation of the fluid that is accumulating in the pleural space. After thoracentesis, which is mainly the thoracentesis process, mostly it is for investigative purpose. So if you want to tell the fluid, the amount, the colors and so on, that can be done. But also there is the more effective method, which is chest tube insertion, to help us with continuous drainage of the blood. So there'll be a chest tube insertion to help us in removal of the fluid. And while there's a continuous removal of the fluid, it's also chest tube, one thing it does, it also helps us to remove any air that is present in the same space. And for this purpose, you can assist to monitor the blood that is being lost or the blood that was accumulated in that space. While we have done our thoracentesis and chest tube insertion, while you're still monitoring, you need to also replace the fluids or the blood product that have been lost. So you can put our patient on fluid management while you're monitoring our input and output at the same time. So hemothorax management is a broad one, and we will do this later on the next diseases under pneumothorax. And under pneumothorax, we have a category that is also hemothorax, and the management includes chest tube. So we will look at it in broad and be able to even understand how to handle a chest tube insertion in details. A frail chest. So how does frail chest look like? Frail comes from the word weak, and in frail chest management, we are looking at it in relation to injuries. And when a chest gets injured or a chest gets a trauma, it becomes weak. And that state where our chest is weak because of different reasons, could be fractures, could be traumas, and so on. The state where the chest becomes weak because of those exposures, we call it frail chest. So in frail chest, there is what is very conspicuous for our patient, and this is what we call paradoxical movement. Paradoxical movement. So in paradoxical movement here, it means the chest movements are not occurring in the normal aspect that we expect, such that they say with a frail chest, the detached part of the chest tends to be pulled in when someone is inspirating or breathing in, which is not the normal movement, because when someone is breathing in or someone is undergoing inspiration, we expect the chest to move outwards because there's air going in. But now, when someone is breathing in during frail chest, the chest seems to be pulling in, which is the opposite direction. On the same time, when someone is breathing out, or what we are calling expiration here, with a frail chest or a paradoxical movement, instead of the chest now moving inwardly because you want to breathe out, okay, instead of the chest breathing inwardly because you want to insert pressure and breathe out the air that has been breathed in, so this chest instead blows out or moves outwardly, which is not the normal movement. So in the state whereby during breathing in the chest wall is pulled inside or inwardly, and during expiration the chest is also pulled outwardly, then we call that movement paradoxical, meaning it's happening in the opposite direction. So when you're managing a frail chest and you want to observe the mechanics of breathing, we say that there's a dysfunctionality in how the breathing mechanisms are happening, and so this tends to affect ventilation of the patient, giving this patient a state of dyspnea, which in regards we mean difficulty in breathing, and also giving our patient a state of cyanosis. So if you're observing on our chest here, we have a frail chest which is due to rib fractures. So our patient is breathing in, but we know during breathing in, the normal movement is the chest needs to move outward, like what I'm showing there. But in the frail chest, the movement tends to go into the opposite direction. So if you're observing the red pointer here, the chest is moving inwardly, which is not correct. During expiration, we expect the chest to move inward, okay, because you want to insert more pressure and push the air out. But in the opposite, the paradoxical movement is happening in such a way that in this case the chest moves outwards. So your cause, so like what has caused the frail chest, and then you apply pressure dressing. Pressure dressing here we mean getting enough gauzes or materials to just patch where the chest injury has happened, and you stabilize that patient so that there is no further movement or destabilization around the injury, and then turn your patient into a comfortable position. Although sometimes they advise you turn them into the side of the injury. But again, you need to remember that you need to put this patient on pain management, and you can use analgesics to do that. So the purpose here is to relieve pain, but also because you are relieving pain, you're able to put your patient into a state whereby they can have proper ventilation, proper chest expansion so that they can get enough oxygen and avoid development of any state of hypoxia, okay, or hypoventilation. Then in case the injury is severe, you can prepare for surgery so that they can stabilize the chest and avoid further damages. Pulmonary contusion is another type of frail chest injury. So pulmonary contusion means a bruise that is happening on the lung tissue or lung parenchyma. And if you look at a bruise, we mean this is a mild injury that is occurring from internal part of the tissue injuries, and it looks like a bruise. If you've been able to observe a bruise on the wall, I want to zoom this more, to zoom this chest. So if you've been able to observe a bruise even on the skin, most of the time it looks inflamed, it looks reddish, it looks like there's tenderness on it, and that's the same state a pulmonary contusion will look like. Presenting with tenderness, the signs of bleeding on it, redness, and so on, and fevers coming up because of the inflammatory processes. They're having issues of edema, secretions increasing, and as a result, our patient can also expose these fluids to further areas around the parenchyma and lead to inflammation of the parenchyma, what we call pneumonia, sorry, in this case. Tamponade. This is a compression on our heart as a result of accumulation of fluid in the pericardial space. And remember, we are focusing all this under injuries or under chest injuries. So we're talking about a chest injury leading to cardiac tamponade, or a state of an injury that leads to damage and the fluids or the generations of the fluid or blood hemorrhage that is happening accumulates in the pericardial space. So as a result, giving us a state of cardiac tamponade. And cardiac tamponade will behave more of a chest injury but affecting the cardiac system. And so as a result, our patient in this case can present with signs of failing of low blood pressure, diminished heart sounds, dyspnea, cyanosis, and also shock. So the symptoms of cardiac tamponade will depend largely on the severity of the damage, based on either the penetrating injury, blunt injuries, or even any other disorders that can lead to this form of injuries. But the main focus here is the injury. And in this case, remember we have fluid accumulation here. So you can manage this by including pericardiocentesis, which is simply a state of removing the fluid that is accumulating in the pericardial space by aspirating it out. So mostly this is done as an emergency relief procedure to just improve on the hemodynamic functions if you're yet to have surgery to be done yet. So you get to aspirate the fluids out there and relieve the heart from excessive pressure due to the fluids. While you've done that, please prepare for further management, and that is through surgery, a procedure we call thoracotomy, to just control bleeding and repair any further damages that could be happening into the heart. So this, remember, is a summarized way of handling chest injuries, but I always advise please revise further, read more, and get to understand the deep management around it. Otherwise, if you keep up with our channel, you'll realize that you will keep on discussing these conditions and you'll be able to understand them in more details. So keep it here. And completing it is complications of chest injuries. So the chest injuries can complicate into aspirations, atelectasis, pneumonia, emphysema, and also respiratory failures. So like I've encouraged, keep it here. We will still discuss all these conditions, and please remember to subscribe. That's it, guys. If you enjoyed this channel and you feel it's helping you learn and clarify a lot of what you've been having as questions around conditions, please keep it locked, like our content, comment, share, and remember to subscribe. Have a lovely day.